First of all, I think it is important. The clinical history is extremely important, as well as the clinical examination, the family history, and then also the diagnostic tools, which are the neurophysiology, which is important as it will define what type of Charcot-Marie-Tooth disease the patient has. As we know that there are two main subgroups, they are called CMT1, or demyelinating, and CMT2, or axonal. I think the important thing for other professionals is in the clinical history. So asking questions to patients such as how long have you had the symptoms for, asking about questions on the first decade of life, as this condition usually starts in the first 2 decades of life. And I think it's important also to put some emphasis on whether the patient had any difficulties with doing sports or running fast or having difficulties fitting shoes in the first decade of life. The family history is extremely important, as this is an hereditary neuropathy. So sometimes, most of the time, patients can have a family history, so other family members affected. And this really helps with the diagnosis of CMT. And then is the examination. So I think the examination is mainly to explore the weakness in the distal part of the lower and the upper limbs, usually with the weakness of ankle dorsiflexion, difficulty standing on the heels, the absence of the reflex or reduced reflex, the presence of foot deformities, which is also another clinical features, and also the sensory examination, because with sensory loss, like the pinprick or the vibration loss in the distal part of the lower and upper limbs. I think also for other professionals, when do you suspect CMT is when there is a long-standing, very slow progression course of the symptoms. They usually start early on, and sometimes patients, they don't realize, and you need to really ask specific questions about their childhood or early adulthood.